Congratulations to everyone who have cleared NEET PG 2025 exam. You got your results, you got your seat, and you are about to enter residency, which is the most intense, cruel, beautiful, life-changing phase of your life. Yes, many emotions next 3 years, and everyone will congratulate you. Everybody will tell you to buy this book, do these duties, learn that skill. But remember, nobody will tell you what will happen to you after you join residency. Not your seniors, not your professors, and definitely not your favorite coaching institutes. After you get a PG seat, everyone will think that your life has got set and you have to be left alone in the forest. But the actual truth is, in that forest, many animals are ready to eat you alive, and that forest is nothing but your residency. So this is the time you need guidance, and this is the time you need someone to tell you the harsh reality, so you will be prepared for your life and prepared for doing this residency without getting tensed or without becoming a prey in that forest. So in this video, I'm going to break down the 10 most important things that every new resident must know before they join the residency. That is about life, clinical work, academics, money, relationships, and what not to do in the residency so you won't be crushed. This is Dr. Jaswant Tankala, MD General Medicine and a rheumatology resident and a part-time YouTuber, and I welcome you to my channel Dr. JTM, and we are very close to 100k subscribers. Please do subscribe to the channel so that we can reach that milestone as soon as possible. And without any delay, let's begin it. Number 1. Residency will break your schedule before it makes your career. Forget about your old routine, waking up at 10 a.m., 12 a.m., sleeping at 2, 3 in the midnight, eating whatever you want, going and hanging out with your friends whenever you want. All that routine you have to forget and keep that aside, because your daily routine changes and that routine will be tough and new time schedules will be given, which is really impossible for you to follow. Residency is always unpredictable. You will never know when you will be called for night duties or emergency calls or special duties wherever you are needed. I know that hits you like a wave, but understand that just stays for a few days. Don't be very scared that life has thrown you into this and regret why you have taken this branch or taken this college. Don't start hating that branch or college or seniors or professors. It is very early for you to understand about the residency or the branch or college in the early days of your PG residency. I suggest you need to adapt to the situation instead of finding perfection. One of my seniors and mentor told me those who adapts to the PG residency well is the one who can really survive the real world outside when they start their practice. Residency teaches you how to adjust, adapt, and survive the life. Remember this, always have a snack in your pocket or in your bag, because you will never know when you will get a break to eat food. So even 5 minutes of free time will be enough for you to take a food break, eat that protein bar or banana. Rule number 1 in the PG residency is never stay hungry. Never ever. Have a pocket notebook. This habit will really change your life as a PG resident, because you have to take notes in the ward. You have to note down about the referrals, phone numbers, lab values, whatnot, everything which is useful and also useless into that book. Have a power bank. Remember one thing, you should never have your phone switched off. This might seem funny, but aapko daat padega. Your seniors or professors, whenever they call you, if they get a busy tone or your phone is switched off or not reachable, you will be having a hard time. So always carry a power bank. And last, power nap sleep. Just like your phone needs a power bank, you also needs a power recharge. That is power nap sleep for 20 minutes, and that will be gold. Anytime that you get a chance to sleep, take a power nap, because remember, in PG residency, God will teach you how badly the sleep is necessary for you. You always wanted to have some good sleep, but you will never have time to do that. Number 2, clinical skills matter than your rank. The real game begins now. Nobody will even care about your rank. Do you think I'm joking? Only on the first day you will be asked about your rank or NEET PG marks. Then after, nobody even gives a damn shit about your rank. After clearing NEET PG, everybody thinks that you should know everything right from the day one. But you are in a zone where you wanted to learn, where you want someone to teach you, and you will be disappointed thinking that you don't even know the simple and easier things. People will start judging you by how well you start learning skills, how fast, sincere, and loyal you work in the ward. For example, previously it used to be like how fast you can make or solve a MCQ, but now how fast you can cannulate a patient is more important. Previously it used to be how confident you do your grand test, but now how confidently you present a case and how responsibly you handle the patients is important. So in the first month, you will only be working mechanically. You won't even get that kick which you wanted in medicine ward after diagnosing a case or doing being a OT in surgery bench. It would be really great if you get a chance to prescribe your own medication or even get a chance to assist in a case in the OT in surgery department. So it will be only mechanical work in the first few months. But remember, do every procedure you get. Ask questions at the right time. Ask confidently and be confident even if you don't know the answer. And just tell the person who asked you a question that I don't know the answer, sir. I will learn it today, and note that question in your notebook and study on the same day. Learn the real medicine that no textbook teaches. Number 3, seniors make you or break you. Handle them smartly. Seniors are the biggest headache or biggest asset in your residency. I suggest choose a right senior. That means a senior who is humble, who is ready to teach you, who don't degrade you or who just sees you as you are. Be a shadow to that senior. Learn everything from that senior. A good senior or the real senior will teach you in life more than any unit chief or the HODs of the department. Your approach should be very simple. Always be respectful to the senior. Be reliable to them. Don't unnecessarily argue. At the same time, you don't even need to take the disrespect. If you didn't like anything that they said, just say I did not like it and just move on from that place instead of escalating the issues. And don't even be over friendly at the beginning, because anything over will eventually come back and reverse hit you. If you become the PG who finishes work, keeps calm and backs the team, any senior will be ready to support you and fight for you. Number 4, academics. Don't lose track in this chaos. Residency is not just duty, it is training. Listen, this is what happens in residency. You will enter on the first day, which is very exciting and happy. Then it is work, 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 eat, sleep, work, 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 work. 6 months just gone like a jet speed. You will not touch any book. You don't know where your notes is. You don't know what you have learned in the past 6 months. Everything seems just like a hard labor work. So what I suggest is start early. After you adjust to the residency, have a digital PDF of your standard book and mark the case that you have seen daily in that book and read the protocols only, the standard protocols in that standard book for 30 minutes daily. Then also maintain 3 to 4 lines of an interesting case that you see daily and have a discussion about that case with your co-PGs or your seniors. Or you can also ask ChatGPT or Perplexity about that interesting case and try to summarize the points from the ChatGPT and study that for 10 minutes daily. Learn and complete at least one topic per week. One topic is enough for the 6 months of time where 24 topics will be completed. Remember, that compounding effect will make you so good even your seniors did not study that much in the 6 months. Attend department classes even if you are tired. I know we also used to skip, feel tired, sleepy in that academic classes, but if you have good professors who teach you or good CMEs or seminars, please go to that academic classes and attend and learn as much as possible. Because trust me, those persons who study consistently will become a great consultants in the future when they start their practice. Learn to present a case like a consultant. This one skill will change everything. During rounds, you need to present the case in a crisp, logical and structured way. I am telling you again, whatever you talk with confidence. Don't let the opposite person know that you don't know anything or you are underconfident or you are afraid of him. You have to talk confidently, tell about the case in the form of story. Tell the summary. What do you think about the diagnosis? What should be the next investigation that has to be done? What treatment that can be given? What are the possibilities? Tell your views confidently. And if you don't know, ask. Just ask them, and if they teach you, very good. If they don't teach you, that means they're lost, because even they don't know about it properly. If you present like a consultant, then people will start taking you seriously. You have watched House MD, Good Doctor web series, right? What did you learn? Your presentation, your vocabulary and your attitude matters. Number 6, protect your mental health from day one. Residency will push your mind harder than your body. The physical exhaustion which you have during the residency is visible, but the mental exhaustion you will not know until the full saturation of your mind has reached. I am telling you this because you will see death. You will be blamed even there is no fault of yours. You will feel burnt out. You will doubt yourself. But you need to remember, cry if you wanted to cry. That is not weakness. That is letting out your emotions. Always have a friend or senior whom you wanted to share hear things. It's not emotionally being dependent. It means having a healthy relationship. And please don't carry the hospital madness to your home. Home is a place where you need to find peace, and it is your personal space to enjoy your own time. Don't gossip or worry about the frustrated things that are happening in the wards or hospital departments. And never ever take extreme steps in these 3 years of residency. To that matters more than your PG seat, your life and mental health is important. One bad day doesn't make you a bad doctor, and nobody in the hospital has rights to decide what type of doctor you will become in the future. You only can decide what kind of doctor you can become in the future. Number 7, money management. Start immediately. I know your stipend is not huge, maybe peanut. It feels like money is not sufficient because your expenses has suddenly increased because you need to go for dinners, cafeteria, parties and outings. This happens. But do you know when I started my investment? Right from the first year of PG residency. Be it 1000 rupees or 5000 rupees or even just 100 rupees a month, you have to make a habit of investing instead of saving. Because if you get married in these 3 years of PG residency, then gone. Your life will be shattered financially because you are not financially independent by the time. I'm not telling you to not get married in the residency, but what I'm telling is make a habit of investing right from the beginning. So do this. Have a monthly budget. Start a SIP early. Avoid EMI traps. Keep emergency savings. Avoid unnecessary shopping for Big Billion Days or Great Indian Festival. Doing this, you will become financially independent and smart one day. Yes, I will surely help you guys with money management and also investment plans in residency, which is a must. But if you want it, comment as investment in the comment section. I'll make a series of videos on how to invest money and manage money during the residency, and also I will help you personally. Number 8, learn hospital politics without getting involved. Every department has politics. Faculty versus faculty, senior versus a senior, senior versus a junior, groups inside groups. As a fresh PG, stay neutral. Don't gossip. Be nice to everyone. Do not take sides. Your only loyalty should be learning and patient care. Number 9, handle patients and relatives like a professional. Patients teach you more than textbooks. Be kind but firm. Be empathetic but clear. Don't promise the outcomes if it is not under your control. Document everything. Only documentation will ever save you from anything in this PG residency. And importantly, your communication will save you from anything that comes your way. Poor communication skills is the second most common cause of attacks on doctors nowadays. If you are poor at communicating, learn the communication skills. If you don't know how to learn communication skills, then you reach me out in the Instagram. I will teach you how to communicate well with patients, because communication will earn a lot of respect and money for you in the future. Number 10, residency will change you. Finally, I wanted to tell you that you will enter as a student, you will exit as a doctor who have seen life, death, madness, hope, whatnot, everything. You will develop confidence, maturity, emotional strength and practical wisdom which you had never had before. 3 years of residency will change you. A boy will become a man. A girl will become a strong woman. But importantly, you will become a professional specialist doctor in your respective field. This journey is blissful, tough, harsh, beautiful and evolving. But just remember, you are not alone. Every resident before you survives, so do you. And one day you will become that senior who starts teaching your juniors. That's it for this video. If you want more videos on how to survive the first month of residency, or what are the gadgets that are important in residency, or what are the books to study in medicine, how to prepare seminar presentations, or how to money manage in residency, just comment down as residency 2026 and I'll be going to make those all videos. If you love this video, please do share, like and subscribe to the channel. I'll be back with one more great video. This is Dr. JT signing off.